Heart disease, the overlooked number one cause of death in women, and what conventional healthcare is missing for healthy hearts. I'm Dr. Sarah, and today we're going to discuss heart disease, and especially how it pertains to women. See, heart disease is the number one cause of death globally and nationally for all genders. Yet many biological women worry more about their breast health than they do about cardiovascular care. Why? The fact is that women have a greater risk of dying from heart disease than all other cancers combined. And this holds true regardless of race or ethnicity. Furthermore, older women who are cancer survivors are more likely to die from cardiovascular issues than from cancer reoccurrence. So why does breast cancer get so much of healthcare's attention regarding disease prevention over the primary cause of death? I think it's for several reasons. First, the fear of cancer is understandably astronomical. Two, most of conventional treatment options for cancer are more involved, more expensive, and they come with a lot more severe side effects than heart medications. Three, a desire for early prevention to stop progression, most likely due to the first two factors I just discussed, fear and the treatment options with a lot of side effects. And then fourth, the media's attention to promote awareness of breast cancer is likely based on these factors of fear, treatment options with side effects, and a desire for prevention. And then five, the symptoms for heart problems are underrecognized and can be even different for women. So today, what I want to go through in this particular video and in the accompanying article that will be in the video description with all of the references as well as additional resources are some statistics on women and heart disease, traditional risk factors for cardiovascular disease, the cholesterol and statin controversies. I'm going to go there a little bit because I think it's important, specific risk factors for women's heart health, and the missing link for holistic cardiovascular care. Actually, there's several missing links that we'll discuss. Now, all genders are going to benefit from this knowledge and the learning about the risks of heart disease, because understanding what you can change regarding cardiovascular health can help empower you to make different choices on your wellness journey. So let's get started. Here's just some statistics and some facts to take home about women and heart disease and why this topic is so important for everyone to pay attention to. Women have a greater risk of dying from heart disease than all cancers combined, which I just went over, and it's true for all races and ethnicities. In 2020, heart disease deaths were about 1 in 5 female deaths. And research shows that only about half, or 56% of women, recognize that heart disease is the number one killer. 5-year survival rates are as high as 93 to 98% when cancer is diagnosed before it spreads beyond the breast. So even though there's a lot of fear with breast cancer, when caught early, the survival is very, very large. That being said, we just discussed why it can often be overlooked in women. Again, the fear of cancer, the conventional treatments and side effects, the desire to stop progression and to actually prevent it, media attention because of these facts, and symptoms are under-recognized. So I don't want this post to be all dreary, because there is good news. When we do things that are good for our overall health, it prevents both heart disease as well as breast cancer. So things such as diet and exercise, and I also would like to add, probably most importantly for reproductive and cardiovascular health, are other factors of wellness, such as nurturing supportive relationships, balancing emotional health, and stress reduction. I'll get into that a little bit later. But for now, let's go over some of the traditional risk factors for cardiovascular disease. Now, some of them you don't have control over. They're based on biology. They're based on other factors. Some of them you do. So these are lifestyle factors that you can modify. Now, the things that are not really controllable are your gender. So males do have a higher percentage, older age, family history, being postmenopausal because the estrogen declines, Now, some races do have a higher risk, even though it's still the number one cause of death for all races and genders, but specifically African American, Native Americans, and Mexican Americans are more likely to have heart disease, and then genetics. Now, risk factors that can be controlled related to lifestyle or certain interventions are things such as smoking, cholesterol numbers, which is something I'll get to in a minute. I couldn't even spit it out. Uncontrolled high blood pressure, physical inactivity. I hate to say this word, but obesity in quotes because it's an association, and I won't get on that soapbox, but it's depending on if the person's inflamed and doing all these other different lifestyle factors. Uncontrolled diabetes, high C-reactive protein, which is an inflammatory marker, uncontrolled stress, depression, and anger, poor diet, alcohol use, and then there's a missing factor we'll get into that's not even mentioned in most of the references that I saw for experts as well as on conventional cardiovascular care websites. And it's the number one risk factor actually for death from cardiovascular disease. So I will discuss it in a little bit. But recently, the American Heart Association actually updated its life essential checklist for heart health, and now there's 8. They added sleep to that. So healthy sleep is important for optimizing heart health. The other 7 that were previously on that item checklist were nicotine exposure, physical activity, diet, weight, blood glucose, cholesterol, and blood pressure. Those were the key factors for heart health, according to the American Heart Association. Now, the American College of Cardiology also provides their own risk factors, and they actually use an atherosclerosis cardiovascular disease risk calculator. So doctors can plug in certain risk factors, or you can even do it. There's consumer sites that are available. I have one of the links in my article that is in the reference in the video description, but that helps determines one's 10-year risk for cardiovascular event based on age, sex, race, blood pressure, history of diseases, lifestyle factors, and cholesterol levels again. So cholesterol keeps popping up. It's, again, kind of like breast cancer, gets a lot of news regarding one of the main components of heart disease, but is it? That is a good question. So now we're going to go a little bit into the cholesterol controversy because it's important. It's listed as a risk factor for both men and women, and we know that there is an association with heart disease. Now, the relevancy of having high cholesterol in relationship to heart disease is contentious in medicine, maybe even more so than the actual treatment of it. The subject is complicated, and mortality outcomes for cholesterol has been mixed in the literature, meaning people have been shown to die from heart disease regardless of if they have high or low cholesterol. There hasn't been a magic number in the literature. So it's complicated. And the impact of cholesterol on heart and overall health is based on very interwoven factors that interplay with cholesterol to make it either inflammatory or have other characteristics that can impact the blood vessels as well as our overall health. So the aspects that are associated with the influence of high cholesterol and cardiovascular disease are looked at from an integrative naturopathic and functional medicine to be associated with several factors. I'm going to list just some of the main ones that most of these integrative doctors, functional and naturopathic doctors, would look for when someone has high cholesterol. They'd look for inflammation. They'd look for endothelial, which is blood vessel lining health, because that is very important as far as the overall health of the blood vessels and how your blood flows and how your blood pressure is handled, and if there's going to be potentially any damage down the line. Your microbiome impacts your cholesterol levels as well as your heart disease risk. There's association studies on that. Lipid particle size and proteins. So not just the fact that there's high cholesterol, but are those cholesterol, is the cholesterol, the LDL and the HDL small? Is it large? Is it buoyant and fluffy? Is it inflammatory? Is there oxidative stress present that could make the cholesterol more unamicable to your blood vessel linings? We also look at blood sugar and insulin levels because this can impact heart disease as far as the effect that blood glucose has on blood vessels. Dental health, your oral microbiome will influence inflammation and cholesterol, as well as heart health. Infections, interesting, high cholesterol and lipid levels will sometimes rise when someone has a microbial infection or some sort of disease process with a microbe. And that's because lipids can bind microbial toxins and neutralize viruses. And they also have other things that they do. So sometimes because cholesterol can come out to play as a healing response, cholesterol levels will rise when someone has an infection. Environmental toxins also impact cholesterol levels. Thyroid health. Actually, before we had statin medications, a lot of doctors would look first to thyroid health because you need optimal thyroid hormones to help you with optimizing your cholesterol levels. Liver and digestive health are related to cholesterol levels. And then there's diet, and then there's dietary cholesterol, which is another whole contentious debate. But it's likely that it is not as impactful as we once thought, including cholesterol and saturated fat in the diet. Now, that's a whole other article. Again, a link in the video description if you want to dive deeper. But it may be related to how someone absorbs cholesterol, how they excrete it, and the production factors specifically based on their particular biochemistry on how much what they eat is going to impact the levels that are seen in the blood. So the fact that cholesterol levels can rise and fall based on so many different biological processes and all these different aspects has caused many physicians and scientists to have different viewpoints on how to address it. Because if you're not looking at these underlying issues, right, you're going to just think high cholesterol might be a bad thing. So one of the first things I do, and we're trained in naturopathic and functional medicine to do, is to look for the root cause of any issue and not just treat the lab marker, but to treat the person. So unless there are dangerously high levels, it must be treated by a specialist and must be referred to. Usually the best course of treatment will be decided once the cause is found. And this is in conjunction with conventional care, making sure that the standard of care is appropriately met. Now, there's another controversy when we talk about optimal treatment, and that's the cholesterol S word, statins, right? So again, another debate. Now, some medical experts stand by statin therapy and because they feel that it decreases overall mortality from different epidemiological studies. Now, this is for a variety of reasons. They argue that if cholesterol is low enough, it's hard for cardiovascular disease to progress. They also feel that statins reduce risks by differing at points for heart health, such as ApoB, for example, it can lower. But others don't agree that statin is the answer. And there was a recent review on 5 different landmark cholesterol studies that touted benefits for statin. And the authors highlight that it might have been overstated because what was being reported in the literature was a great amount of a decrease for risk for heart disease, but they were based on relative risk rather than absolute risk reduction. So what that means is there's 2 measurements that you can see when you read different scientific abstracts and studies. Now, the relative risk is different than the absolute risk. So for example, if we use a relative risk for, say, that a heart attack occurs in 2% of people versus in the placebo group, and in 1% of those in the drug-treated group, then the benefit of the treated population is only 1% point better than no treatment. That is the absolute risk, actually. Now, if we say that there's a difference of 50% because 2 is 50% higher than 1%, that would be the relative risk reduction. So it can conflate, right, some of the impact of the drug or any intervention. Even supplement interventions can do this. It can conflate the efficacy because you're saying that there's a relative risk reduction of 50%. That'll make headlines, 50% reduction in this wonderful intervention. But really what it is doing is only decreasing someone's risk by 1 percentage point at an absolute level. So that's something to be mindful of. And what they found in these 5 landmark studies that said that statins were having these very impressive decreases in cardiovascular mortality. So they're based on relative risk. So that is definitely going to be a study that gets a lot of attention, and I'm sure a lot more debate than what I have time and what we have bandwidth to go over here. So just keep that in mind when you're looking at different things. Another thing that we can do when we look at any form of treatment or medical intervention is they have this thing called number needed to treat. Number needed to treat is how many people need to be treated in order for one person to have an effect on that intervention. Then there's also number needed to harm, which is for every person that gets a benefit, how many people are harmed. So if we look at those taking statins for primary prevention who don't have a history of heart disease for 5 years, 104 people need to take statin to prevent one non-fatal. So it's a heart attack, but it doesn't cause death. 1 in 50 people who take it can develop diabetes, and 1 in 10 can have damage to their muscles as a side effect. So there you have to weigh the risk versus benefits. Now, for those with known heart disease, the number needed to treat is lower. It's 1 in 39 for a non-fatal heart attack and 1 in 83 for lives actually saved. The number harmed remains the same. So 1 in 50 will develop diabetes and 1 in 10 can have damage to their muscles. Again, risk versus benefits, right, for any medical intervention. So I just want to say, we've gone through some of these risk factors. We've talked about overlooking the number 1 killer in women and some of the reasons why. And the number 1 killer, this heart disease, cardiovascular disease, has been this way for a long time. It's not moving the needle as far as we're not making good headway in cardiovascular disease, moving down the line to not the number 1 cause. And I think one of the main reasons for this is like what I said. When I was going through these different references and resources so that I could have references with what I was saying when I wrote the post for you and when I did the video for you, I was astonished that the number 1 risk factor for cardiovascular mortality, and it wasn't mentioned in a lot of these traditional risk factors, and that is related to social connection. It's perceived loneliness. That increases the risk for cardiovascular mortality, and healthy relationships actually buffer a reoccurrence when someone's had heart disease. And many are not aware that relationships impact cardiovascular risk more than lifestyle, more than cholesterol, more than any other factor. And for women, this can be especially relevant because women tend to be more dependent on emotional connection than men. It's just a biological need, right? Based on our brain biochemistry and how our hormones impact our brains if we're biologically women versus if we're biologically men. And estrogen also impacts the heart. So it makes sense that women who are postmenopausal, who are isolated, who don't have good relationships, and then their estrogen levels, which protects the heart, goes down, could be more at risk. But what we're finding now is new literature and new reviews are showing that even young women are at risk for heart disease. And one of the issues that they say is because, well, now there's more disease burden on younger women. They have more of the risk factors. They might be have a higher history. They might have more high blood pressure, high cholesterol, higher cigarette smoking. And then they added the caveat to they were more likely to be low income, have a history of depression, and have significantly worse health status compared to men in the study. This was based on women, young women with heart attacks having a greater burden of risk factors compared to men. So I think this is very telling that the low income and depression are mentioned because these are 2 factors that, again, largely found in the data that correlate to heart disease, depression especially, and low socioeconomic status. to be risk factors for all diseases for men and women. Now, another recent study in women found several additional cardiovascular disease risk factors associated with heart disease risks. And again, it repeated economic stability, neighborhood safety, working conditions, environmental hazards, educational level, and access to healthcare. So all of these things are precursors to what's being ignored, right? We can tout all of the wonderful lifestyle things someone can do, but if they don't have access to medicine, if they don't have access to actually go outside because it's not safe and take a walk, or to get healthy foods, it's kind of a moot point. But if we know this, and then we know one of the number one buffers is community and social support, there's a way to move the needle for that, right? So again, heart disease continues to be the top killer for all genders. I'm just going to summarize for you. The traditional risk factors, lifestyle factors, even high lipid levels can play a part in cardiovascular disease. I'm not saying they don't. They definitely do. But they only address partially what makes for truly healthy hearts and lives. They fall short of what our heart needs most. And this is through love, through social connection. Literally, the thing that we need to incorporate the most is often ignored, is free and accessible to everyone. And concerningly, many women don't even know that they're at risk. We need to step back in medicine and look at the whole person. We need to realize that some of these outside factors we can't biochemically and biologically manipulate are some of the most important things that keep people alive and want them to thrive and have better, healthy hearts. Literally keeps their heart pumping, right? So that is my soapbox for cardiovascular disease, the number one overlooked killer for women, and still the number one cause of death in men and women. But there's a lot we can do. So go ahead and send out that random text to someone you care about, make their day, make plans to put down the social media, put down some of the work, and get out and see some loved ones and make healthy relationships a priority. And if you have access, do all this other stuff. Do the healthy lifestyle, nourish your body, take care of yourself, try to decrease your stress, try to meditate. We'll go through some of these different factors in another video, and I do have some previous videos on cardiovascular care, even using essential oils. So we'll go into that a little bit more at a later time. But for now, I just wanted to get this main message out there. And I work with a lot of women. They're basically my main focus in my practice. I do work with men too, but I just think this is an important area in women's care, in hormones, right? Because that'll be another topic, how hormonal symptoms can sometimes be misconstrued and they're actually heart issues. So we need to look at this. And again, I will stop now, but thank you for joining me, and be sure to look in the video description if you want additional resources, classes, education from me. I will be making a pretty cool announcement soon regarding a program that I'm offering that's going to incorporate the whole, the mind, the body, and the heart. So if you want to not miss that out, be sure you get on my email list. Thank you for taking the time to listen and for empowering yourself and your heart. And I hope you take gentle care of yourself and that you can reach out and get some love and get love today. Take care.